Have you ever heard of the drug morphine? Well, here's what you need to know. Classified as an opioid agonist, morphine is used to relieve severe pain. Some medical names for morphine include Astromorph PF, Doloral, Dormorph PF, Epimorph, Morphine HP, and Statex. Some street names for morphine include Morph, Miss Emma, Monkey, Mr. Blue, or White Stuff. Morphine can be taken as a tablet, syrup, injection, in some cases smoked or inhaled. Morphine is a heavily regulated drug that is legal when prescribed. Without a prescription, it is considered abuse. Possession of morphine without a prescription is a criminal offense, the degree of which varies based on location and amount of drug in possession. How does it work in the body? Morphine binds to opiate receptors in the central nervous system. It alters the perception of and response to painful stimuli while producing generalized central nervous system depression, ultimately causing a decrease in severity of pain. Common effects of morphine include euphoria, pain relief, sleepiness or unusual drowsiness, reduced anxiety, false or unusual sense of well-being, and relaxed or calm feeling. The federally designated Schedule II drug, morphine, is used to treat moderate, severe, and chronic pain, pulmonary edema, pain associated with MI or cancers, and shortness of breath at the end of a patient's life. Now for a little history. Morphine is a naturally occurring substance extracted from the opium poppy plant. Its chemical makeup is similar to heroin, as they are both extracted from the same plant. Morphine was first extracted from opium in a pure form in the early 19th century. It was used widely as a painkiller during the American Civil War, and many soldiers became addicted. More than half of accidental drug deaths in the U.S. are caused by heroin and morphine. In recent years, morphine pills have added abuse detergent coatings so that they cannot be crushed, snorted, or injected. While this has reduced the addictive potential of prescribed morphine, it has not eliminated its potential, and it has not impacted illegally manufactured morphine. Morphine's relative accessibility and rapid tolerance of the drug causes morphine to have a high potential of abuse. As a narcotic drug, morphine is often abused for its pleasurable effects because it depresses the central nervous system, leading to addiction both physically and psychologically. Overdosing on morphine can have serious consequences. It can lead to unconsciousness, coma, or slowed breathing to the point of death. Addiction typically begins with a tolerance, needing larger doses of morphine to feel its effects. Some side effects of morphine on the body systems include, for central nervous system, dizziness, confusion, euphoria, and seizures. For cardiovascular, palpitations, bradycardia, shock, and cardiac arrest. For ears, eyes, nose, and throat, is blurred vision, meiosis, and diplopia. For gastrointestinal, nausea, vomiting, anorexia, constipation, and cramps. For the respiratory system, respiratory depression, respiratory arrest, and apnea. Who's at risk? Those suffering from chronic pain have the potential to misuse their medication, which increases their likelihood of developing a substance use disorder. Relieving pain after surgery can lead to dependence on the drug if not careful. Anyone who uses a drug for recreational purposes beyond the scope of legitimate prescription increases the risk of becoming addicted to the drug. Always keep in mind how morphine affects the body and the potential for abuse. Presentation brought to you by Marissa Brown.